There are four main steps to patient flow: rooming and preparing the patient, initial screening for diagnostic studies, physician's treatment and assistance, and patient discharge and education. When a patient arrives, their first contact will be the lovely front office, in which they will be introduced into the system and their paperwork and insurance information will be gathered. They will then place a flow sheet and an H&P form in the patient's chart holder, indicating the patient is ready to be seen by the physician. As the back office assistant, this is where your job begins. You will look to find the patient's name in our computer system. By pressing on their name and going to the Room button, you will then room them in the system. Now, if the patient is not a new patient, you will go to the Chart button in the same medical system, and you will look to see what their last visit was for. It is important that you gather this information so you can be prepared and ready to find out what they're doing, how they're doing, and if there's been any improvement or not. The information you will gather will be information such as where the problem is, what the problem was, and what has been done in the past to help. If they are a new patient, you will need to gather this information. When you call a patient to a room, be sure to speak clearly and loud enough for the patient to hear. It is custom to call the first name, but if there are multiple patients with the same first name, you may need to state the last name as well. This is really something that is up to your personal preference, so you may choose to state their name however you wish. If the patient is new, make sure you introduce yourself and welcome them to the office. Because their first impression to the office and their treatment is you'll need to be warm and inviting. You will guide the patient to the room that they'll be treated in. Make sure to walk at a pace comfortable for the patient. As they walk to you, you'll be able to gauge the speed to which to lead them to the room. You will instruct them to have a seat in the treatment chair. You will then let them know you're going to tilt them back a little and also raise their feet. Chair position is very important. If you place too little tilt and too much foot lift, you will make the seat very uncomfortable. The idea is to tilt the patient back far enough to allow a slight break at the knees, while still allowing the feet to be raised high enough for the physician to treat them. Depending on the area of concern, the chair will need to be adjusted. In general, a tilt back and foot raise with an even break in the knees is most comfortable, as it is more of a cradling position. If the area of concern is on the bottom of the foot or the back of the heel, the chair will need to be raised higher and a greater tilt applied. The idea is to make the patient as comfortable as possible, while still making the physician as comfortable as possible treating the patient. Keep in good communication with the patient and ask them if you can adjust anything to make them more comfortable. Practice by seating each other in the chair and find the things that are and are not comfortable. This will help you to keep in mind the comfort of the patient, who is the one who actually needs to sit in the chair. After you seat the patient, you will then take off both shoes and socks for the patient in preparation to seeing the physician, and so you can touch and troubleshoot the area of concern. It is customary to take off both shoes and both socks so the physician can see and compare both feet or ankles. If the patient is wearing thigh highs or full nylons or tights, they will need to use the restroom to remove them. If the patient is a female and is wearing a short dress or skirt, take care to apply a drape to her legs so she does not expose herself. It is important to remove both shoes and socks as stated above. Ask the patient where they are having a problem, and then listen. It is not our job to diagnose or prompt the patient, but to listen to their subjective complaints and ask clarifying questions to get the gist of the situation. Do not be afraid to wash your hands and touch the patient's foot to check for tenderness or specific location of soreness. They are in the doctor's office. They know they will be poked and prodded. It will help you decide what the next course of action is on your part, and will allow you to provide crucial information to the physician quicker. Your next step is to take an H&P, or History and Physical. You will have a sheet of paper with prompts to fill out. You need not write a novel. Your job is not to do a chart note or to diagnose the problem, but to quickly get the main idea of why they are here across to the physician. The bulleted items are as followed. The first item is CC, or Current Condition. This is the place where you will write specifically why they are being seen, where the problem is, what happened if it was an accident or injury, and any subjective information they give you. You do not need to worry about medical lingo at this point. This is just what the patient is telling you. The second bulleted item is duration. This is when the problem occurred, how long they've had the pain, and what they did when they first noticed it. Next is timing. This item refers to when the patient notices their symptoms and if the symptoms change depending on the time of day. Quality. This tells us what type of symptoms they are feeling. For instance, hot, cold, burning, sharp, a dull ache or sharp ache, throbbing, anything that helps us to qualify the sensations they feel from the problematic area. Sometimes they won't feel anything. Severity. This refers to how bad they're feeling their symptoms. There are multiple ways to gauge this. You can use a mild to severe scale, but I find the most useful way to gauge the symptoms is on a scale from 1 to 10, where 10 is the greatest intensity. Context. This refers to what is going on when they experience their symptoms. Things such as while weight bearing, or with increased activity, or if they move a specific way, or stand a specific way. It is what they are physically doing, or what is physically occurring around them when they feel their symptoms. Modifying factors. This is what they have done to try and relieve their symptoms. These things can include icing, stretching, anti-inflammatory treatment, or staying off their feet. Associated signs and symptoms. This is where they would state if their current symptoms are beginning to affect anything else, or if something else that they're experiencing is affecting the symptoms they are being seen for. With these items written down, you are now ready for the physician to see the patient. Again, your main focus is to quickly get to the point of the patient's concerns. You do not need to diagnose or write a novel, just be specific and precise. This information will then be taken to the scribe. The scribe is the physician's real-time assistant, who not only follows and listens to the physician with the patient, but is responsible to document each visit and treatment plan along with the goals of treatment. They are also responsible for billing all charges to the patient. The scribe is a necessary ally in the concept of flow, for it is the scribe that helps to direct the physicians in areas from billing and treatment to what room he's to go in next. Each physician has a scribe, and after you've taken your initial H&P of the patient, you will need to provide the information to the scribe, who will then place it in a chart note and document. It is crucial that you provide enough information for the scribe to sufficiently direct the physician and be sure the information is correct, such as the correct foot or ankle of concern, or what specifically is better or worse. This information must be correct. After the initial H&P has been taken care of, you will need to make a decision based off of the patient's complaint of which diagnostic study is most important for the physician to take. If the concern is found to be more of a soft tissue problem, or non-bone issue, such as a muscle, tendon, ligament, or unknown mass that may be on the foot or ankle, you will need to set up the diagnostic ultrasound machine for the physician. If you find the concern to be of a bony nature, or the result of an injury or trauma to the area, you will need to take x-rays of the area. If it is found below the ankle joint, generally, foot views are obtained. If it's above the ankle joint, you will take ankle views, as well as in the ankle. You will need to see the Diagnostic Studies section for detailed instructions in using the ultrasound and x-ray equipment. From this point, you will then need to prepare the room for the physician. Our office provides opportunities for financial bonuses based on a few different factors. One factor is how long you've been in the office and your level of responsibility. The other is based off of a certain statistical goal you must accomplish in order to qualify for this bonus. As the back office assistant, you will carry two statistics that must be monitored. The first is the perfect assist statistic. This statistic is monitored on a patient-to-patient basis and is built on the premise that for each patient you bring to a room, three main items are addressed. The first is the room is prepared perfectly, with all supplies the physician will need. The second is that the patient is prepared perfectly. This entails chair position is correct for their concern, and their socks and shoes have been removed, even on the unaffected side. 3. Instruments and supplies are prepared perfectly. In clinic, there are a number of procedures that are done multiple times each day, and there's a standard set of instruments and supplies used each time. It is your job to ensure that all instruments and supplies are prepared and ready for each patient. This includes having the ultrasound machine in the room or taking diagnostic x-rays as well. The purpose for this statistic is to help you look ahead at not only getting the patient in the room, but preparing the room so that everything the patient can possibly need is prepared and at the ready. This will ensure an easy and happy flow. This stat is highly dependent upon following your own opening procedures and correctly preparing the clinic before patients are seen. The second statistic you will keep is the dollar per patient statistic. With each patient we see, there is a list of charges that will be billed according to what the physician did for that patient. The reality is that in order for a business to remain in business, it must make money. The more charges we bill per day, the more money the clinic makes. The purpose of this stat is to keep the back office assistant mindful of how we're treating each patient. Now, if you're not careful, you may just look at the surface of this statistic and assume it means we need to charge the patient more. Although some of this is true, you need to understand the underlying reason we want to increase our dollar per patient number. The reality is that your job as a back office assistant, or as a scribe, or as a physician even, is difficult. And even if your flow is going perfectly, you will hardly have time to relax. As humans, when we work hard and constant, we tend to get fatigued, and if we're not careful, we could begin to neglect patient care and just try to survive our day. By making this a statistic, it will help us to reach in and find that strength to provide that extra special care to each patient, and it will be a win-win situation. The patient will receive the proper care they deserve, and will be able to charge for more services rendered. This being said, we are not in the business to offer unnecessary treatment at all. But we also cannot undertreat our patients. We would not want to be undertreated ourselves. By keeping yourself aware of the dollar per patient and having a goal for which you will be rewarded, you will be more willing to look past your own fatigue and look for more ways to help and treat your patients. With your stats and goals in mind, and after preparing the patient, the physician now is ready to see the patient. As the back office assistant, you are to be exactly that, an assistant. Preparation is only part of the assisting duties. You are also called on to provide assistance to the doctors and patient during any office procedures or visit. We do many different procedures in the office and give many different types of injections, as well as do casting and other different services, some of which you will need to be present in the room to provide supplies or support. The rule of thumb when assisting is to first, prepare the room as perfect as possible. Second, be mindful of your flow. Keep the patient rooms full with patients. And when you have time between these two goals, you will need to be in the room or at the doorway, ready to do whatever the physician needs. There will be many times when you are unable to be in the room with the physician. However, if you prepare the room perfectly, he should not need you for anything. This is your main goal. When finished, you will be responsible to put shoes and socks back on the patient, as well as provide any cleanup or education the physician would like. This education could be anything from stretching and icing exercises to the types of shoe gear that will fit best the patient. Proper education and reassurance is crucial in the healing process of our patients. Make sure you instruct them to call with any concerns they may have. We're here to help. By now, you can probably see how important each of the opening procedures is to being able to see patients in a timely manner. As the back office assistant, you will be moving very fast, and you will see many patients. The smooth transition and ability to see patients on time will depend highly on your ability to prepare each room and yourself to be as efficient as possible.